This video is all about LowerCrossed Syndrome, one of NASM's 3 primary postural distortion syndromes. So when we find LowerCrossed Syndrome, generally what we're going to see is this excessive lordosis, or this lumbar curvature of the spine, and also anterior tilt of the pelvis. All right, so again, from our lateral view, generally we're looking for like a large exaggeration. Hard sometimes for people to even get into, but this could be a combination of things. As far as overactive muscles, just think about what could be pulling us in that direction, in that position. The 2 most likely overactive areas are going to be the hip flexors, right? If we have tightness in the quads, the psoas, the iliacus, that could be pulling down on our pelvis to pull us in that position. And then also these lumbar extensors, low back muscles. If either one of both of those is overactive, it could be pulling us in that position. The other issue could also be underactivity. We could have some muscles that aren't firing enough. And the easy thing about the hips is if we see potential overactive, all we have to say is potential underactive. It's kind of this cross pattern in the body of the opposite muscle groups. So if we have overactivity in these hip flexors, well then we probably have underactivity in the hip extensors. Hip extensors are going to be our glutes as well as our hamstrings. And then same thing, if we have overactivity that may be pulling us into that extended position, right, that anterior tilt, we may also have underactivity, especially with some of our deep core musculature. So this is a really important area, especially when we get into squatting, deadlifting, lunging, these lower body movements. So this is one you're going to want to look out for, and also see, does this show back up inside of some of my other movement assessments like the overhead squat and my push-pull assessment.